All right, welcome back, beautiful people. This is Forever Young. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour.
Today we've got an important topic, I think, that ranges from teen years all the way well into our adulthood. It's annoying, unsightly, and frankly, it can change your ability to be in social situations, whether it's perceived by yourself or others. And so today we want to talk about acne.
Ooh. And again, this is not just for adolescents, but it applies to adults. And at the end of this podcast, we'll actually talk about how to deal with acne scarring. Mm-hmm. So what we'll do is we'll go over a view of what causes it, how to avoid it, what are the stressors, and how to treat it. And then if you've been one of those people that has had acne, or picked it, or scarred, we'll talk about what we do as plastic surgeons to remedy the problem. Definitely. Or improve it at least.
Definitely, and I think not everybody can make it out to a plastic surgeon or dermatology office. And so what we want to do after we describe it, we're going to give you some at-home remedies to kind of solve some of these issues. And then if it just doesn't work or it's more intense or you need some help, we'll kind of give you some clues as to what you should ask for when you go see your dermatologist or plastic surgeon. And so I want to at least take a step back. We're going to talk about the 4 different types of acne, all annoying, each one worse than the other. And it all starts out with blackheads. Secondly, we look at sebaceous filaments. Thirdly, we talk about regular acne. And then lastly, we're going to talk about cystic acne, and that is such a devastating issue that many teens undergo. And then you are scarred for life. And so the idea is we obviously want to treat some of these things early because, it really can pivot the confidence that you have in public. And so, man, I remember in high school, you're going through those tough periods and, everybody's going through puberty and things like that. All of a sudden, you've got a huge zit right in the middle of your forehead or on your nose or something like that. And you say, how can this happen?
I had a buddy that wouldn't come to school if he had a pimple. Okay. The interesting part is nowadays there's actually this one company that just sold for $200 million, and I don't know what it's called, but they make stickers, okay, that have a little medicine on them.
Yep.
But they put them on, and in a sense, it's kind of cool to go to school with a little sticker on. I saw it the other day with one of my nieces, and I said, "What are you doing?" She goes, "Well, I've got a little pimple, and I don't want to show it." We didn't have that when we were kids.
Well, listen, so blackheads, we all know those pesky open comedones that form really from when hair follicles become clogged with excess oil, and then it comes packed with, dead skin cells, and it's often those dark spots that appear on the face, slightly raised. And everybody wants to pick them. It's just we're pickers by nature, and that's why pimple poppers is so popular and things like that. So again, these are not where we're getting to be complex, where it looks like there's pus behind them, things like that. Although it can progress to that. The idea is these are most commonly found on the nose, and you just have that urge to just pinch and express all of those little dead cells.
And some people have oilier skin too, so they'll be a little more prone to this. So if you have that, maybe making sure you can get that under control. And sometimes that's very difficult too.
Definitely.
But yes.
Yeah. So listen, how about this? We're going to give you a little bit, a mask and a kind of an exfoliator that you can do at home. And so let's use some natural ingredients. We'll give you a honey and cinnamon mask. I'll tell you why it's important, things like that. So we're going to mix a tablespoon of honey with a pinch of cinnamon. And then you apply the mixture to the affected areas. You leave it
delicious.
on. I know. You want to eat it. But you leave it on for 15 minutes. And then you rinse for a natural antibacterial boost. And the amazing part about these things is both of these have antibiotic properties and antioxidant properties. So we're actually providing nutrients to the skin. This will help avoid the blackheads from progressing to something else, something that can be a little worse and scar forming. And that way it will give you a nice refresher. So maybe we want to do this once a week. And that way it kind of gives your skin a natural refresh and you smell good.
And if you don't want to do it at home kind of thing, there are different ways to take care of these. I really recommend going to a skincare professional, whether it's an esthetician, to do a monthly just clean up facial, extract some of these blackheads or maybe even the whiteheads that are there, and make sure that you kind of keep that oily skin in check. Now, you can get a little bit more invasive. It'll be very similar to the non-invasive approach that we just talked about, the do-it-yourself. But you could do chemical peels that are either administered by a plastic surgeon or a dermatologist. I would recommend doing a very light, maybe TCA, because acne doesn't need very heavy peels to get rid of the blackheads.
Sure. Even salicylic acid.
Absolutely.
Benzoic acid, things like that will help lightly exfoliate enzymatically on the skin. And again, these things kind of offer some antibiotic properties, and it will only improve the health of the skin.
This is not something you should do, just like Dr. Lee, like you said, on a regular basis. At most, these types of peels shouldn't be done more than once a month. It should be even pushed out even more than that. The other treatment that can be done by professionals is a microdermabrasion. And that's just really complex way of saying a way of sanding the outer layer of your skin to remove those dead cells and have good, clean, new cells to come up. And really, that's like the simple way to take care of blackheads. Now, there are other really cool, like remember those
Biore strips?
Yeah, you put those strips in and pull them off. The one thing I recommend that you don't do not pop them yourself. So once you start doing things like that yourself, that's when you can lead in to some scarring. So the key to all this, if there's one takeaway you take after this podcast, is do not pick your skin. Have a professional do that, because that is what is going to eventually lead to acne scarring.
And if you can't make it to a physician, or it's too expensive or something like that, use the at-home remedies to essentially really detoxify and clean the skin.
And the treatments we're going to talk about, they're going to apply for the different types of acne. So as we talked about, first was blackheads, and now we're going to move on, but different treatments are really good for different types of acne. The one also thing I'm going to tell you at the end, all of this stuff is caused by bacteria. So at the end of the day, if you have really bad acne, if you have really bad acne, you're going to need some sort of antibiotic to fix it. But let's move on to the next one.
Yeah, I should have prefaced everything by saying that each one of these things are caused by three things. One, the sebum, which is the oil that we have in our skin. The second is an accumulation of dead cells and some bacteria. And the third is that it's hormonally mediated. And the hormones can be triggered by anything from stress, which is an increase in cortisol, foods like chocolate and things like that. The idea is that complex sugars can cause an increase in hormones delivered by the body. And all that does is cause an increase in oil production in the skin. So if we talk about the second type of acne, it's sebaceous filaments,
also known as whiteheads.
Yes. And so these are just the buildup, same thing, of sebum, which is the body's natural oil, dead cells, and debris, and it leads to visible congestion. So this is actually where you start getting a little bit of redness, stretching, and enlargement of the pores. And people come to us because it drives them absolutely crazy. So even after your teen years and 20s, when the acne season slowly fades, now you're left with those stretched pores. And people say, oh my gosh, it makes you look older. And how can I shrink these pores?
One of the most common things people come to our office is basically, my pores are visible and I want to shrink them.
Definitely. So this one is definitely one where you do not want to squeeze, because sometimes what happens in these enlarged pores is you end up driving the debris deeper. Okay. So I understand if you have the comedones, the blackheads, and you know, those are a little more superficial and raised, and it's easier to deliver those. Whereas once you get to this area, you may drive it deeper, and then it will progress into serious acne or cystic acne. So instead, I'm going to give you a couple of do-it-yourself home remedies. The first one I would say would be a charcoal mask. And so what you can do is mix activated charcoal with water to create a mask. And then you apply it, let it dry, and then peel it off gently to help remove the excess oil and impurities from the pores. And this, again, the idea is that we are detoxifying and eliminating some of the excess debris. And so once you do that and you have healthier pores, you know, I always liken some of these things as pothole, you know, where you've got the lid on top and ultimately it packs everything underneath. And so what we're trying to do is lift that lid so you can express some of these things naturally or remove them. And then exfoliate. Employ chemical exfoliants. These are glycolic and lactic acids, AHAs, and these effectively exfoliate the skin by eliminating the dead skin cells. Again, we are doing this repetitively, so what you'll do is exfoliate enzymatically maybe once a week or at least once every 2 weeks. And what it will do is it will allow the skin, for a layman's term, allow it to breathe. And you're eliminating some of those dead packed cells, some of the bacteria, and providing some nourishment to the skin.
I personally love to have an exfoliator in the shower. I use the skin polish from our line, but again, you can use whatever exfoliator you want. And I do it about once a week. And I think it really makes your skin feel smoother, and you feel like you just are taking that little dusty layer off. And I think it's necessary. I think everybody should do it. And I think once a week is a good call.
Yeah, I think, these mix well with those oils, and it loosens up the oil plugs. So again, the oil is the natural sebum that your body produces, plus dead cells. You pack in some debris and even some bacteria, because we're colonized with bacteria on the skin. And so the idea is if you can eliminate some of these, it makes it easier for your skin to undergo cellular turnover and create healthier skin.
And then, if you're going to come to us for treatment, which we have this in the office and other people do too, get a hydrofacial. Hydrofacial is a great way to clean up your face, get rid of these whiteheads and some of the blackheads. It's a fantastic, very calming facial that not only cleans the face, which is really cool when you do the hydrofacial. It's a suction device that really cleans your face, and at the end you see in this reservoir how much dirt and dust was sitting on your face.
Yeah,
the proofs in the results, right? You see them and you're like, wow.
And I'm telling you, I wash my face regularly morning and evening, and when I underwent the hydrofacial, I looked at the reservoir and I thought, oh my God, it really takes that dirt that's packed into the pores, as well as the old oil and just some of that debris, the dead skin cells.
Absolutely.
And really gives you a cleansing phenomenon. And then the second half of the hydrofacial is now, instead of sucking, it forces hyaluronic acid into the skin. So now you're applying something that can help really hydrate, moisturize the skin, and provide those nutrients to make it much healthier. And so,
absolutely,
not everybody can make it to the physician's office, but let's say you're doing some of these home remedies and it's just not enough, then I would recommend heading out, save up, get your hydrofacial, and I think it's a couple $100, $250, something like that. But if you're having some issues with your skin, honestly, save your allowance. If you're working, put it towards skin, because the healthier your skin is at a younger age, the younger you will look as you age. And so, again, it's much harder to treat retroactively than it is proactively. And so the idea is once you've already sustained the damage, some of that is irreversible. And so the goal for us is to try to prevent this right off the bat.
Absolutely.
So now we get to the next level, which is regular acne. And this is a common skin condition characterized by the formation of pimples and whiteheads. This occurs when the follicles become clogged with oil and dead skin cells. Again, it all boils down to oil, dead skin cells. But this leads to various forms of inflammation in the development of various types of acne lesions. And so these are the ones that, especially in your teen years, when your hormone levels shoot through the roof, the skin can suffer. That's why we see oily skin, especially in teenagers. And it's hard to control it sometimes. And so number one is look at some of the things that we've said earlier. Use those on your skin. And now if it doesn't work, let's move into the next realm or the next level of treatment. So if we look at do-it-yourself or at-home remedies, the goal would be, let's say we do a tea tree oil spot treatment. So you can take dilute tea tree oil with a carrier oil and apply it directly to the pimples. And tea tree oil has antibacterial properties that can really combat acne. And so the goal is, now we've got a pore that's packed with oil, dead cells, debris, and some bacteria, and now you're starting to see some inflammation. And this, again, is one of those things where you just want to start popping, and honestly, you are going to damage your skin. I know sometimes you feel like you're going to resolve the issue earlier. Sometimes what you need to do is allow the skin to express the pimple all the way to the very end, and then if you just brush it with your nail, it comes right off. But once you start squeezing, imagine that you are taking all of the dead skin cells, debris, and oil and bacteria, and you can drive it deeper. And that leads us into the next category. Now it's definitely you've damaged some of the healthy layers of the skin.
However, for a lot of people, there are inciting factors or things that you're doing that's causing it. And, teenage girls especially, makeup, watch out. The oilier the makeup, the more comedogenic, because what it does, it causes comedones. Comedones are pimples, and they're clogged pores. So you have to realize that if you're doing something that's causing these things, perhaps if you take that stressor away or what's causing it, some people say it's chocolate, some people say it's greasy food. These things are all possible, but the key is to see what's causing it, pull that away, and then if you have it, then treat it. And most of what we're going to talk about, and what we have been, all of these things are antibacterial and clean the face. So everything is about cleaning and getting rid of bacteria and making sure that too much oil doesn't form.
Definitely. Let's say you get to this point and you're sick of these breakouts, and the idea is you're going to need something that's a little more advanced than using apple cider vinegar and some of the previous treatments that we talked about. Now, again, we've given you plenty of DIY things to do at home, so try doing some of these first. If it doesn't work, that's when we got to start talking about laser treatments. Sometimes different laser therapies, they target acne-causing bacteria, and they also kind of reset the skin. We see this in elderly individuals, or I should say older individuals that undergo a laser treatment to try to improve the texture of the skin. Sometimes they have breakouts afterwards because it resets and normalizes the skin, adds a little more oil to dry skin. But it also does some of the opposite when you have excess in oil. And so it forces the removal of some of the top layers of skin. Now, again, these are a little more invasive. And so depending on the level of treatment, so let's say you undergo a fractionated CO2 laser, a light laser will have a few days of downtime. There's no doubt. If you do, a heavy laser, that's a week of looking like you're in a house fire. And so the goal is to try to avoid getting there first. And so use some of the previous DIY treatments. That way you can clean your skin, remove some of the dead cells, purge some of the oils naturally without having to squeeze or cause unnecessary inflammation. And reduce the bacterial load on there. And so, these are just little tips and tricks to try to help improve your skin quality at home.
And if not, then we're just going to go back to using, Clearasil. And again, those things work really well. So topical over-the-counter benzoyl peroxide, for example, it's been the go-to for years and years. So if some of these do-it-yourself remedies that we're giving you don't work, that's a very simple fix. You go to any drugstore, get benzoyl peroxide. It comes in 5%, it comes in 10%, and it's generally very safe. The one thing it does do is it really dries the skin, but it does have antibacterial and basically decreases the production of sebum. So that's how benzoyl peroxide works. The other thing your dermatologist or plastic surgeon may say to you is, hey, we need to give you oral antibiotics or topical antibiotics. So Cleocin or clindamycin pads are great. We've used them for years. That was my go-to forever. I mean, if someone comes in with bad acne, I say, listen, let's get some Cleocin pads. You can just clean your face. What it does is it really just cleans the face, gets some of the bacteria out, and dries the face a little bit.
And again, you have to take into account the reason why we're telling you right off the bat is to try to keep your skin clean at an early age, because even the Cleocin pads and some of the benzoyl peroxides, the Cleocin pads have an alcohol base, and so that they're going to dry the skin from oil. But at the same time, some of these compounds can be irritating, and so the goal is to not get there. Once you're there, you have limited options because you've already sustained the damage, right? And so let's work our way up the ladder. Start with cleansing. Start with gentle exfoliation, usually enzymatic exfoliation. Use some of these masks on a regular basis. Try to undergo a regular facial, maybe once a quarter. The idea is to keep your skin clean, so you can essentially keep that pH balance, as neutral as possible. Absolutely. Now we get to the next level, and once you've reached cystic acne, all bets are off. This is where now you have destroyed the skin. And so this is a severe form of acne, and it's really characterized by deep, painful lesions, often inflamed nodules and cysts. Sometimes they can be filled with pus, and they can be red and irritated. They create these hardened nodules. And this is usually where people are fed up and they really try to squeeze these out.
These are the ones that hurt. They actually hurt.
Yep. And this is where you're going to cause scarring. You have damaged multiple layers of the skin. The inflammation has already caught up. That bacteria is causing redness. Sometimes people get pretty severe cystic acne. And so when this happens and it goes unchecked, you will have ice pick scars for the rest of your life. We're going to talk about some of the treatments once you do develop some of these things. But again, the idea is to see someone before you get there. Do not wait. Try to see a professional, because that can save you from years and years of discomfort and really a reduction in confidence. I see so many people come in and they say, I've dealt with acne my whole life. Now I have all these scars. How can you make them go away?
And it's interesting because, if it's really bad, and we'll talk about it in a second, an oral medication can kind of get rid of all of it. It's not the safest, but at the same time, listen, and we'll get into it right now, there are ways to really clean up the skin so you won't have that. The key to what we want to talk to you about is the sequelae of what's going to happen if you don't treat these properly. Because acne scarring, and I'll tell you right now, we treat it all the time. It is very difficult to treat. It's just difficult. Someone comes in with really any kind of scars, but scars on your face from ice pick scars or acne scars, they're difficult. And especially depending on your skin tone, it may make it even more difficult. So what we'll do is we'll give you some DIY tips. But when it comes to cystic acne, most of the time, these don't do as much as something a little bit more of a little stronger.
Ice compresses are going to be something that you're going to put on first. The goal is you want to reduce the inflammation. Mm-hmm. And if we can slow the progression of that inflammation, then you have a chance of potentially treating it. The other thing, when we look at compounds that have major antioxidant abilities, that may have some antibacterial properties, a turmeric mask is something that you can use. That you can use a little turmeric powder, add water, and create a paste. And then what you do is you can either put it on as a mask or you can do spot treatments. And the goal is really, again, to reduce the amount of inflammation, to reduce the amount of bacterial load, and really to try to stop these cystic acne lesions from forming. But usually we have to go to the next step.
And in severe cases, dermatologist, go to your dermatologist. We have our favorite that we're going to have on the show soon. Mm-hmm. And you should be started on Accutane. And Accutane is a medication that needs to be taken seriously because it has side effects. It has issues if you don't do it. It has sensitivity with the sun. You have to stop it before you have procedures. There's a lot of things that we could have to do a whole podcast on Accutane. But it is a miracle drug. And I will go as far as saying I have never seen it not work miracles on people. Every single person that takes Accutane, it does really well. Just have to make sure that you're not childbearing at all, like not even close to even thinking about having a child, staying out of the sun, and really sticking to the regimen and not having any procedures. It's something that just takes seriously. Normally, about a 3-month course will get you.
Yeah, some people, I would say it's 6 to 9 months. Okay. And what I would say is, remember, this is a last resort because not only does it affect the liver, Some people can't be on it because it beats up the liver. You have to get your labs drawn, regularly to ensure that you're not damaging your liver. It can have amazing effects on the skin, but again, it comes at a cost. And so for people who've been on Accutane, you cannot have a surgical procedure. It used to be a year after. Yeah. Now some people are saying 6 months, but the reason for that is because the scars will heal so horribly that it is not worth it. And obviously it causes fetal malformations and all kinds of things. So once you get to the Accutane level, this is a commitment.
But it's worth it. I mean, it definitely is worth it.
Yeah, it'll definitely clear up some of the acne breakouts that you have. It's it's an extended period of time. So again, it is a commitment. You're going to be doing your homework with it, but the idea is it's effective,
very effective, and should be given by your dermatologist. I will say, regardless, though, you have to be very patient. These treatments that we're talking about, unlike some of the surgeries that we do and unlike some of the treatments that we do that are really kind of instantaneous in a sense, or maybe take a couple of weeks, these take sometimes months to years to really accomplish. And I mean that from the laser treatments, the Morpheus treatments, and even some of the treatments at home. Have to be patient, because here's the thing. It took time for the blemish to come out. It's going to take time for it to go away.
Yeah, you probably had a period of years where you went through acne scarring and things like that. Now to eliminate it in a month is just not possible.
And we understand. Over the years have tried to develop different products for it, and it's hard because everyone's acne is a little bit different. And I do think that the most important thing is just to really kind of maintain your hygiene and see if you can figure out stressors. If you can figure out why you're getting a pimple, maybe that's the best way.
It could even be a food allergy.
Absolutely.
The idea is, if there are any parents that are listening right now, don't let your kids suffer like this. The idea is, even if you have to hammer home the fact that they need to cleanse their skin, if you start noticing that your son or daughter is starting to have acne breakouts on a regular basis, listen, everyone's going to get acne, okay? It's just part of adolescence and puberty. But if you start noticing that they're accumulating these acne scars and they are resorting to picking their skin, or you notice that there's some pretty bad acne, don't let them suffer through it. Make them cleanse their skin. Use some of these at-home remedies. It doesn't mean you have to take them to a physician right away, but make sure that they understand the importance. Show them pictures of someone who's got acne scarring. I mean, just go on your phone, look at Google, and say cystic acne, and that alone should scare someone.
Scare them away.
Because it will forever change their life and the trajectory of their confidence. Honestly, it's unfair because some people get it more than others. We don't know why. We could say there's a genetic component, but we aren't sure. But the one thing that we have said is it all comes down to oil production, bacteria, and dead skin cells.
If you like this video, you're going to love this one. A lot of women live with very large breasts, and when they tell people that they're having a breast reduction, people are like, what, are you crazy? People go and get breast augmentations. Why are you making your breasts smaller? And I've heard this so many times from the lay person out there, and it's a really uneducated thing to say.